Hello and welcome to Build Healthy Places Network video snapshot series. So Build Healthy Places is a national organization working to shift the way health, community development and health sectors work together to improve health in neighborhoods across the country. So we're excited to introduce our guest today, and that's Professor Carrie Henning-Smith, who is an assistant professor of public health in the Division of Health Policy and Management at the University of Minnesota. There, her research is on health equity and looks at the structural barriers to health and well-being and how lived environments, both immediate and geographical, impact health. So welcome, Carrie.
Thank you. I'm delighted to be here. I'm a big believer in the work that you do at Building Healthy Places Network, and I'm excited for our conversation today.
Thank you. Yes, me too. So tell us a little more about your work at the University of Minnesota Rural Health Research Center. The rural healthcare systems that we hear about continue to work through many challenges, but what are some of the challenges to addressing social determinants of health in rural communities outside of the health setting?
Thanks for the question. There are a lot of challenges. By definition, rural areas are different than urban areas. You have fewer people and people living farther from one another. The areas are less densely populated, and that creates a lot of challenges for resource and service delivery. Things like transportation infrastructure, getting people from point A to point B, is more complicated when you have people living farther apart and when you have fewer people. Rural areas also have fewer economic resources. In general, people have lower incomes and higher poverty rates. We also see higher rates of people being uninsured in rural areas. People tend to have lower educational attainment on average in rural areas, and there are fewer educational opportunities available to people there. We see real issues with food insecurity and limited access to healthy foods in rural areas across the country. You might have one grocery store in your town or community, but you don't have a lot of options, certainly not the sort of options that people have in many urban communities. But in acknowledging all of these different social determinants of health, and I could go on and on and on about them, I won't, but I could. I think it's also really important to note that rural areas are not monolithic. There are rural areas that are thriving. There are rural areas that are really struggling and need more resources. Rural areas span frontier Alaska to the US-Mexico border region, mountainous regions, the Northeast, the Southeast, the West, and where I am in the Midwest. These all look different. The challenges tend to be very different from one community to another. It's also really important to recognize that not all rural residents are the same. We have a temptation to portray rural residents as white and male and farmers, and there are definitely white male farmers in rural areas, but there are a whole bunch of other people too. 1 in 5 rural residents is Black, Indigenous, or a person of color. That's a percentage that has been growing and shows no signs of stopping growing, largely thanks to immigration to rural areas. And we know that BIPOC individuals, Black, Indigenous, and persons of color in rural communities face more challenges as they relate to social determinants of health, getting access to high quality housing and education and food and transportation. We also see that play out in health and health care. In research that I've done at the University of Minnesota Rural Health Research Center, we have found higher mortality rates among residents of counties where the majority of the county is either Black or Indigenous in rural areas. So this is not withstanding what happens in urban areas, but in rural areas. And we've also found that Hispanic or Latino residents of rural areas have more compromised access to healthcare. So lower rates of preventive care usage and lower access to care in general. I want to acknowledge that in rural areas, there is one real strength, and this is one consistent strength that we see across the board. Rural residents tend to have stronger and larger social networks. They tend to be very well connected with their neighbors, with their communities. But given all of these social determinants of health and the inequities within rural areas that I mentioned, there are structural barriers to connecting people with one another. For example, I've done some research showing that older adults in rural areas have more friends and more family members than older adults in urban areas, but they are still more likely to say that they're lonely. This tells me that there's something stopping them from having that meaningful and that necessary social connection with other people.
Yeah, that's fascinating. And it's a great point about social connection. So this year, Build Healthy Places teamed up with NeighborWorks America to produce a series of fact sheets highlighting the role of community development and how it can play a role in health partnerships. And one of the topics we covered was social isolation, which is certainly something we come to now with a greater personal awareness, I think, than ever since COVID experience this year. But beyond COVID, social isolation in itself is a big challenge to the healthcare system in terms of treatment and also costs, for socially isolated patients, and their things like higher rates of readmission. So I'd really like to dig a little deep and tell us a bit more about the issue of social isolation as in rural communities in a broader sense, and the role you see perhaps community development playing as a partner in that.
Yeah, absolutely. As you mentioned, social isolation and loneliness are important health outcomes in and of themselves, and they're also risk factors for other negative health outcomes that we want to avoid. Everything from mortality to hypertension, increased risk of Alzheimer's disease and cognitive decline. The list goes on and on and on. And so there are all sorts of reasons beyond what I think should just be a moral imperative to make sure that people are getting their social needs met. In rural areas, there are some specific challenges to helping people stay socially connected. And a lot of those have to do with some of the issues I mentioned earlier. People live farther apart. It's harder to get people together physically. That might not feel as relevant during the age of COVID when we're asking people not to be together physically, but it can be a real barrier. Transportation infrastructure in rural areas is a real barrier to getting people together, and just getting from point A to point B or getting to a community center, a senior center, is more challenging in many ways in rural areas. There's also this huge piece with technology. Here we are on Zoom. I think that a lot of us are living our lives online these days, for better or worse. For some people in rural areas, that's not an option. A lot of rural areas don't have reliable access to broadband internet, and rural residents are less likely to have smartphones and to have computers or tablets or devices, even if there is broadband internet. So we have a real digital divide that we need to address to make sure that everyone has equitable opportunities to stay socially connected or to engage in employment or educational opportunities online too. There are so many ways that we're living our lives online these days. So everything from the built environment of a community to the technological infrastructure of a community, those are all places where cross-sectional partnerships and community development can really get involved and make a difference in people's social lives and people's health outcomes. For the built environment, there are a lot of things that can be done in rural communities, focusing on walkability, bike lanes. Rural communities are much less likely to have sidewalks, to have safe walking paths. You'll sometimes find people walking along busy roads because there aren't other good walking paths. That's a real opportunity to address the built environment. Also making sure that there are safe and accessible and inclusive gathering places, community spaces, so parks and community centers, farmers markets, all of these things that some of us take for granted should be available in every community across the country to give people that opportunity to connect with one another. And addressing some of the socioeconomic disparities that I mentioned earlier will give people more opportunities with which to connect, more time to connect. If you're not always worried about where your next paycheck is going to come from, you may have more opportunities to socially connect with others. I want to share just a couple examples so that I can make this a little bit more concrete. And both of the examples I'm going to share are from Minnesota, which is not to say there isn't great stuff happening around the country. There is, but these are communities that are near and dear to my heart. And I have a couple of pictures from time that I spent in each of these communities last summer, back when I was visiting communities, which I hope to do again soon. Ashley, could you pull up the first picture? This one is going to be from Albert Lee, Minnesota. And this is a town of just about 18,000 people in southern Minnesota. So it's not your tiny rural town, but it's still classified as a rural community. It's kind of a larger town in a rural county. This is the county seat of Freeborn County. And Albert Lea is a county or a city where they had noticed that they had a bunch of health disparities relative to some of their more urban peers and relative to some of the other communities across Minnesota. They were seeing poor health outcomes and a variety of issues. They also have an aging population, which is very common in rural communities. There tends to be an older age structure in many rural communities. So leaders in the city of Albert Lea partnered with the Blue Zones Project, which is an international organization that's headquartered in Minneapolis here in Minnesota. And working with Blue Zones, they worked really hard to make the city more age-friendly and more socially connected and more cohesive. There are a lot of things that they did to make this happen. They partnered with employment, with workplaces. They partnered with restaurants and retail, with community organizations, with civic leaders to see if they can get everyone on board to do programming that was accessible regardless of age or disability status or income. But they also did a lot of work to address the built environment in their community. So what I'm showing you here, this was from a very rainy day that I was there last August. I think that were it not a rainy day, you would see more people walking around. But they spent a lot of time building sidewalks. Seems so simple, but they built sidewalks throughout the community. And here this is looking out over the lake in the middle of town. And they built a walking path so that you can walk along the lake, get exercise, connect with other people. They also have this gazebo with a lot of seating, a lot of bench seating around that makes it accessible for people, ramps so that people can get into this area. And they hold community events and concerts in this gazebo. What you can't see is that standing right behind me is a weekly farmers market that comes in there now. And all of this has brought a lot of vitality to the community and a lot of opportunities for neighbors to connect with one another. Obviously, this was pre-COVID. I expect that it will be just as vibrant post-COVID. And the next picture I'd like to show is from Willmar, Minnesota. This is a rural community that's about the same size as Albert Lea. It's in western Minnesota, and it's the county seat of Kandiyohi County, which is also a rural county. Willmar, Minnesota has an interesting history. It's home to a meat processing plant, but its history for years and years, decades and decades, was of being very steeped in European heritage. It had a lot of immigrants and then their ancestors from Western Europe. But in the past few decades, they have seen an incredible increase in an immigrant population from East Africa and from Latin America. And this didn't come easily to all of the residents of Willmar, Minnesota, but they decided, the leadership of Willmar, Minnesota decided that they were going to come together as a community and find ways to work through what might feel like cultural divides and cultural misunderstandings to try and build more social cohesiveness. There are a lot of things that they did to make this happen, a lot of community events. The mayor passed a welcoming community resolution. But one of my favorite examples, and again, a very tangible example that I think we can see how development, how cross-sector partnerships could get involved here, is this playground. This is called the Destination Playground. It touts itself as being one of the largest accessible playgrounds in the world and among the largest in the upper Midwest. I can vouch for this. I had my kids go and play on this playground, and it's huge and they loved it. And what's cool about this playground, beyond it being really big and fun, is that it was built by nearly 4,000 volunteers in the community. And these volunteers came from all walks of life, all pockets of the community. They came together. They spent more than 9,000 hours building this playground. And in doing so, relationships were built. In talking with members of the community, I heard about how this was a formative period where people started to establish trust and get to know one another as neighbors, as community members. You can see on the sign there, it says welcome in English and Somali and Spanish. These visual clues are also really important to seeing who's welcome. And in a rural community where the population tends to be smaller and sometimes a little more close-knit, these clues are all the more important to make sure that everyone feels welcome and included so that we can build that social cohesion.
That's great. Thank you for sharing those examples, Carrie. And it really shows a real spectrum of points of intervention along a life course too, from the elderly sort of mobility issues to the younger members of the community. That's really helpful. So, you know, I've mentioned it a couple of times, and in the times we are now, we have to mention and look at COVID. The pandemic has really highlighted the sort of health inequities that exist across the country, exposing especially some racial disparities in health and well-being that you alluded to earlier that existed even prior to the pandemic. How has this shown up in your work, and what role do you see sort of cross-sector health partnerships playing in ensuring that we achieve an equitable recovery for all?
Such a good question. So the work that I do focuses on inequities in health and quality of life for all rural residents, ideally for everyone. And COVID, as you say, hasn't created these inequities, but it has revealed the depths of the inequities that were already there. And it's made it clear that we have so much work to do to ensure that everyone has a level playing field. I think one place to focus is on preventing and reducing social isolation and building that social connectedness that has implications not only for reducing loneliness and all of the health impacts that come from that, but in building a strong community that can be resilient and respond to other health crises, or let's hope we never have to live through another pandemic like this, but that can help make a community more ready to deal with emergencies and natural disasters as they come up. One extreme example, rural areas have higher suicide rates than urban areas, and they are trending in the wrong direction. There's a lot of reason to believe that COVID is making that even worse, that COVID is exacerbating mental health issues and feelings of loneliness and isolation. It's pulling us apart. We've seen a lot of political divisiveness that's also pulling us apart, and a lot of rhetoric about political divisiveness in rural areas. I think we need to do a lot to work beyond that too, and cross-sectional partnerships that bring everyone to the table and give everyone a voice are really pivotal in making sure that that happens. And so I think when we're thinking about those partnerships, the healthcare system is clearly a part of that. Back to social isolation and loneliness, those are costing the healthcare system $6.7 billion in Medicare expenditures alone annually, let alone everything they're costing everyone who's not a Medicare beneficiary. The healthcare system has a role to play in screening for loneliness, in helping to create referrals and making sure that they detect that. But they can't do it alone. They need to work with all of these other systems, transportation and education, civic leaders, restaurants, employment sites, all of these other systems that we've talked about to build healthy communities and to make sure that everyone has a chance to participate and to thrive. There is just so much work to do, but I want to come back to the strengths and the resilience that we've seen in many rural communities. The examples of Albert Lea and Wilmer are not unique to Albert Lea and Wilmer. There are innovative things happening in rural communities across the country. We need to ensure that they're well-resourced and that they have an opportunity to continue to build on that innovation.
Yes, absolutely. And to all those listening, if you want to take a few minutes to review some additional resources, actually, if we could share the fact sheet slide. Some are available on the Build Healthy Places Network, but I'll just show you here. We have our fact sheets produced with NeighborWorks America that cover community development role and the role it can play in counteracting social isolation. Also, a part of the series addresses mental health and we are also releasing one on homelessness. And then if you check, we also have a crosswalk essay. Our crosswalk series is a series of long form essays, and to read more about cross-sector approaches and including the community development sector to combat social isolation. So I just want to say thank you to Carrie for joining us today, and to Ashley Hernandez, my colleague who's helped with production today. And thank you all for listening in.